So that's the percent of ideal body weight. Then we have a percent of weight change, which gives us a snapshot of the weight change over a period of time. And for that, we're going to ask the client their usual weight, or we're going to look in their medical chart at the facility that we're at for their usual weight. We'll subtract their actual weight, their weight today, divide that by the usual weight, and multiply by 100%. And that will give us the percent of weight change. Now, if the client has lost weight, the result will be in a positive number. If the client has gained weight, it'll be reported as a negative number. And sometimes that trips up students when they see that negative number, but that's how the math figures out when we have a weight gain, okay? Once we've completed this percent of weight change, then I'm just going to skip ahead to the next slide here. Then we'll want to look at the assessment of weight change. It's one thing to figure out the math and do the math, but what are we going to do with that information? So if the loss is 1 to 2% of their weight in 1 week, it's considered a significant weight loss. If it's over 2%, it's considered a severe weight loss, okay? Oftentimes we'll use the 1 month and the 3 month marker to give us this assessment of weight change. And certainly if someone has had a severe percent weight loss, we're going to put them at that high risk and they're going to need some intervention. Body mass index, you've all become professionals at completing that. And then in some facilities, especially like a workout facility or a spa, you may be doing skin fold thickness measurements. And certainly that's something that will take a lot of practice. We don't necessarily go over those measurements because quite often in a clinical setting, you're not going to be using that, okay? I put up here a review for the BMI classifications. Underweight would be a BMI less than 18. And then a healthy weight, this says BMI 20 to 25, but it would really be 18.5 to 25 for a healthy weight. All right, I want you to take your text out then, and I'm going to have you look at page 172 in the biochemical tests there. This is a really great reference for you, so you'll want to bookmark this page, you'll want to write on this page, because you'll utilize these labs when you're doing an assessment. And some of these labs can give us information about the nutritional status of our clients, okay? The first two on our list are the serum albumin and serum prealbumin. And as you see on page 172, this talks about the overall protein status of our clients. Serum albumin is a little slower to respond than prealbumin. So if you're looking at changing a client's nutritional profile based on serum albumin labs, it just has a longer half-life, so we have a little lag time. So we might not see an increase in serum albumin for 3 weeks to a month, where we contrast with the serum prealbumin that has a much shorter half-life, and we can start to see the results of our nutrition interventions increasing that serum prealbumin in just a few days, okay? In your book, I want you to cross out the serum transferrin and the total lymphocyte count, the next two labs that you see here on the slide. They're just not utilized any longer in nutrition assessment of patients. So let's not even waste our brain cells learning about those. Then you see fasting blood sugar or glucose. We've learned about that in our diabetes lecture, along with the glycosylated hemoglobin or the hemoglobin A1C. Remember, this is a 2 to 3 month average of what's happening with the client's blood sugar. It's the amount of glucose that saturates that hemoglobin molecule over the time, and then therefore we can see on average how these blood sugars have been running. And recall that the American Diabetes Association goal for the hemoglobin A1C is a level of 7% or lower. Then we're going to move up to what we'll oftentimes abbreviate as the H&H, hemoglobin and hematocrit. These are lab values that we often use to assess someone's iron status. So hemoglobin and hematocrit, make sure you're looking at the normal numbers for male and female as they're